Urology Unplugged, the podcast that brings you cutting edge insights from the world of urology. I'm your host, the interviewer, and today we are delving into the fascinating realm of female urology with a true pioneer in the field. Our guest today is Dr. George P. Abraham, a renowned urologist and renal transplant specialist with over 40 years of experience. Dr. Abraham has performed more than 3,400 renal transplantation and is an expert in handling complex urological disorders. He is also the third surgeon in the world to perform living donor laparoscopic renal transplant and has pioneered numerous endourological procedures in Kerala, India. Dr. Abraham, welcome to the Urologic Unplugged.
Thank you very much for having me on this occasion to discuss some of the common urological problems in females.
Dr. Abraham, you have had an illustrious career in urology. Could you share with our listeners what sparked your interest in female urology specifically?
See, there are some structural differences between male and females. As a result of that, some females are prone to have some peculiar diseases, and such as we know that urology, in female urology also, urinary disease including kidney, ureter, bladder, urethra. And some specific diseases are more common in female because of this, as I told earlier, because of the structural anatomical differences. For example, female, the urethra is very short, 4 centimeter only, whereas for males about 20 centimeter length. Not only that, in females, the urethra opens into the vaginal introitus, and they are prone to have frequent urinary tract infection. Similarly, because of their anatomical differences, pelvic floor muscles can be weak over a period of time, and as a result of that, some peculiar diseases such as urinary incontinence, prolapse of bladder, then uterus, rectum, pelvic floor muscle diseases, all these can occur. They are more common in females. And so that is why we take more interest to learn and to treat these pelvic or female urological diseases.
That's fascinating. Let's dive into some common female urological issues. What are some conditions that women should be aware of?
Because of this difference in anatomical structural differences, female are prone to have some peculiar diseases such as urinary incontinence. As we told, urethra is very small, and because of any particular reason, they are more prone to have urinary incontinence when compared to males. And so urinary incontinence is more common in females. That too, various types of incontinence are there. One is stress incontinence. That means while you are coughing or sneezing or slight movement, there will be involuntary passage of urine. Second is urge incontinence. That means patient cannot hold the urine for some time. They will have the urge to pass urine and they have to rush to the toilet. Sometimes there is mixed incontinence, stress incontinence and urge incontinence, both are there. Some people will have continuous incontinence. People likely there after some surgery, some injuries to the bladder or ureter, they will have a continuous incontinence. Another variety is nocturnal enuresis, that is more commonly seen in children, that is involuntary passage of urine in the night. This is incontinence part. Second part is pelvic floor structures will descend through the introits into the through the perineum or to the vagina, such as the bladder, uterus or rectum will prolapse. That is called cystocele or rectocele, etc. That will prolapse outside of the perineum introitus. Then the overactive bladder is another condition where they're more commonly seen in female, where they cannot control, they will have the urge and they have to go rush to the toilet to pass urine. That is overactive bladder. Then pelvic floor muscles or pelvic painful bladder syndrome etc., etc. These are some of the more commonly seen conditions in females. And these are more commonly seen obese patients, and some other reasons are there. They require more evaluation to find out the exact causes, exact type of the disease, requiring evaluation, and the treatment is according to the peculiar condition for that patient.
Speaking of misconceptions, let's address some myths about female urology. Could you debunk 5 common myths for our listeners?
Females, because of their peculiar anatomical consideration, they have certain common diseases are there. Most important is incontinence of urine itself and some prolapse of this organ. And they are very shy. They because of the ignorance and because they are shy of it, they suffer it, and they will not come to the hospital. They will not reveal to the doctors. But because they have some myths also or some misconceptions also. Some of the misconception is that the incontinence is normal for females in the aging group. As the age advances, incontinence will occur and they are suffering because they think it is part of the life. So they are suffering it. There is no need for a treatment or treatment is not available. Second, some people are aware that some exercise is available that can control the incontinence, such as Kegel exercise. That is the pelvic floor muscle strengthening exercise by which they can completely cure the disease. But it is not like that. That is part of it. We can control to some extent, but severe incontinence require treatment. Third, whether we should take more water or not, patients with incontinence. But incontinence patient also require some adequate intake of water and urine output, that is to prevent infection part. Another thing, they think that by reducing the intake they can control the incontinence, but that is not that. Adequate drinking and intake and output should be there. Along with that, some patients will have urinary tract infection. That is also more commonly seen in females. Whether they require antibiotics all the time, but a good infection requires some antibiotic treatment, but mild infections or symptoms that requires only symptomatic treatment. Then another myth is all the pelvic organ prolapse require treatment or not, whether they require surgery or not. But only mild prolapse of bladder or rectum requires only conservative treatment, whereas severe prolapse of the bladder, large cystocele, rectocele, that in addition to some pessary or conservative treatment that is not responding, they may require surgery to control that pelvic organ prolapse.
Those are excellent points, sir. Now let's talk about lifestyle changes. What modifications can women make to improve their urological health?
The most important is the lifestyle modification is very, very important. That means usually these symptoms are more in obese patients. So most important, you have to reduce your weight because obesity will produce more pressure on the bladder, then incontinence is more common. So one of the important factors is weight reduction. Second is adequate exercise, including Kegel exercises, pelvic floor exercise to improve the muscle strength of the pelvis to some extent that can prevent improve the incontinence as well as prevent some prolapse diseases. Then adequate hydration is also very important to prevent urinary tract infection, which is very common in these females. In our habit, we have to modify certain habits. That means there are some people are prone to take more irritant fluids such as coffee, tea, then alcohol and smoking. These are all supposed to be severe irritants to the bladder. So in the lifestyle modification, they have to control these intake of these irritant fluids, then quit or avoid smoking. A healthy toilet habit is also very, very important because that is after passing urine or something, wiping should be done from anterior to posterior. Some people have the habit of wiping posterior to anterior. That can carry infection or that can produce more chances of urinary infection in females.
Those are practical tips our listeners can implement right away. Dr. Abraham, in your extensive experience, what's the most innovative treatment you have seen in female urology?
Stress incontinence is a real serious problem. These ladies, even youngsters, even elders, they suffer silently. And its complications are also very severe because they are wetting always, even slight movement, coughing, sneezing, or even straight movement. In severe incontinence, they cannot go to office seat because leaking is there. And because of their ignorance and lack of knowledge about this, and because of the shyness, they will not come out and take treatment. But nowadays, excellent treatments are available. In addition to the conservative treatment, sometimes that may not be sufficient in severe incontinence. So, we know that the reason for this stress incontinence is because the mobility of the urethra and because the support is, vaginal support is less, that is the reason for stress urinary incontinence. So, even if with the medical treatment that can improve the condition to some extent, but severe condition that will not be sufficient, they require a surgical treatment. And the recent treatment is a mid-urethral sling, a tension-free vaginal tape. That is the treatment. That is a small operation where the mid-urethra is elevated and supported by using a synthetic sling in the mid-urethra level. That is a small operation, not a major operation. By that, the significant improvement will occur almost, that is about 98% success rate is there. That means that the incontinence can be controlled almost completely by this treatment. And they will not thereafter they will not wet while coughing, sneezing. And that gives their mental confidence, and physically also they will become better. That gives their confidence, their quality of life will be better. That is found to be one of the most important treatment for females for stress incontinence.
That sounds groundbreaking. As we wrap up, what's one piece of advice you do give to women hesitant about seeking help for urological issues?
Ladies with these sort of urinary problems should not get embarrassed because good treatments are available now. And even with medical treatment, and rarely may require some surgical treatment. Almost completely we can achieve a cure of this problem. So always try to get or seek advice from the proper person, urologist, urogynecologist, and they can give you advice, they can examine you, find out the exact cause, and they can give you the proper treatment, and that gives excellent results also.
Thank you, Dr. Abraham, for these invaluable insights. Your dedication to advancing female urology is truly inspiring. To our listeners, remember that urological health is an essential part of overall well-being. If you are experiencing any symptoms, don't hesitate to consult a urologist. This has been Urology Unplugged. I'm your host, the interviewer, thanking you for tuning in. Until next time, stay healthy and keep the conversation flowing.